Next.
Hi, I'm Dr. Julie Bruno.
Hi, I'm Hollis Silverman.
And today we're going to talk about telehealth. Telehealth is also called what, Hollis?
Online therapy?
Online therapy?
E-therapy.
E-therapy, okay. The VA uses the terminology as telehealth, and that's what I know it to be. This is something that is not necessarily new.
No.
Or old.
No, it's been around.
It's been around, right?
It's being used probably more often now.
Absolutely. Because of the internet that Al Gore created, correct? No, I jest. But I wanted to bring this topic up because I do telehealth, and I wanted my clients to know, if they don't already know, which they do, and I wanted other people to know what you need to look for when you're looking for a therapist online. So, first off, what do you look for what do you think you should tell your clients when they're coming to you and they want to do online therapy?
I mean, the first thing that I always say, Dr. Bruno, is they need to find a therapist that is licensed. So it's really, really, really important that, when you're looking for an online therapist, you want somebody who's credentialed. And even if you are in a different state than they are, you feel free to ask the therapist, can I have a picture of your diploma? And they don't necessarily have to be licensed, but at least, if they're working underneath somebody, and they've been working underneath somebody for a couple of years, whether that's a psychologist or a social worker, you definitely want somebody that knows the field and, is not, there's a lot of fraud out there, so just want to make sure that you're protected.
Absolutely, and if they are licensed, you should be able to go onto the Department of Health's webpage in whatever state that they are in and find their license number. So like Hollis said, they don't necessarily have to have a license number if they can't pass their exam. Some people can't. But if they've been working in the field under somebody for 5 years, they're just as good as anybody else, or maybe not, but they definitely have the time in. And then you can make your estimation from that point forward. So, and terminology is very important because a lot of people will classify themselves as psychotherapists.
Yes.
And you think that they have a degree, and their degree could be in physiology.
Yes.
Yeah, they're a doctor, but they're a doctor of physiology. So they're not, a psychologist. So you want to always check up on your therapist. And, honestly, you should check up on your therapist even if you're in the same state. And they shouldn't put any road blocks in front of you in order to do that. The other thing that you want to ask about is what kind of platform are they going to do their e-therapy with?
Yes. So I know, Julie, there's Skype, which I know is not HIPAA compliant.
Nope.
And then there's also VC, which that's what I use. It's encrypted. It's what the military uses. It's very secure. If the military's using it, I certainly want to use it as well. And I remember, Dr. Bruno, you were telling me that they even take pictures of certain parts of the session to make sure that, practitioners aren't,
fudging their numbers.
Yes.
Yeah.
Yes.
And speaking of fudging your numbers, that would be for insurance. That's the other thing that you want to talk about is, will your insurance cover it? Right now, some insurances don't and some insurances do. So if your insurance is not going to cover it, the next thing you should ask about is, how do I pay you? Because, unwittingly, when you work online, your therapist might unwittingly release your information, your financial information, and put you in a situation that they didn't mean to put you in. So you want to know what platform are they using to bill you.
Yes, it's really important, especially, that's your finances and your confidentiality. And just know that when you put yourself online, through online therapy, you are taking those risks because it is over the internet. Yes. So, it's just important to understand.
There's always that 1% rule that your confidentiality could be compromised. To bridge back a little bit, when we say licensure as well, they need to be licensed in the state that you're in. So I might be doing therapy with you. You might be living in Indiana. I need to have an Indiana license and a license in the state that I'm practicing from. that is then goes on to the next part. The reason why that's important is you need to also then be affiliated with a community mental health center or a psychiatrist in the state in which you're providing the therapy in. Why would you need that?
I mean, it's suicidality. If you have a client who has suicidal ideation, if there's abuse going on, if there's domestic violence, there needs to be a mental health facility that they are affiliated with so that somebody from that mental health facility can get to that client. Because, you know, Dr. Bruno and I, if we're working with somebody in a different state, we can't get to them.
Yeah.
Or if you're a therapist and you're watching our video, you can't get to them, right? They're out of state. So that's very, very important while doing online therapy.
So it's safety for your client and it's liability for the clinician.
Yes, absolutely.
Absolutely. So overall, those are just some of the few things that we wanted to outline for therapists and for clients when you're doing e-therapy, telehealth. And thank you.
Thank you so much.
I'm Dr. Bruno.
I'm Hollis Silverman.
Bye.
Bye.